While we are waiting, once again, a very good morning to all of you, and I hope that you will go from here, as Chairman of the Organizing Committee said, saturated with the knowledge of quality. So I'll very briefly tell you about CAHO, as was mentioned earlier by Dr. Gyani. CAHO was born in 2012. It was born in 2012, and it was with the blessings of NABH, with the involvement of NABH, and we are very thankful to Dr. Gyani and to Dr. Kalra for enabling this formation of CAHO. It was also felt that all stakeholders need a platform to voice their concerns and also to share their practices, both the hospitals and the laboratories. So objectives, basically in brief, CAHO was born with various objectives, but the primary objective is to spread the quality of the message of quality throughout our nation and beyond its borders. Quickly, the founder members. These are the governing committee members, and I must also at this time acknowledge our organizing committee members, President Dr. Saudullah, Dr. Nagendra Swami, and his team for organizing this conference today. Now, what have we done till now? It's been 3 years. The first couple of years were spent trying to consolidate, trying to get ourselves organized. But if you ask me what have been the achievements, and I would, as Chairman of NABH said in the morning, the biggest, the most effective in my view was the facilitation of the entry-level accreditation standards in the country. All of us know that NABH has about 400 accredited hospitals, but if you actually look at how it is impacting the population of our country, these 400 hospitals are big hospitals in cities, and they probably cater to probably 0.1 or 0.2% of the population in the country. So quality really hasn't gone into the grassroots. So I'm proud to say that CAHO was involved in facilitating, informing these rules, and we've also been able to handhold with NABH. Together we have been able to try and implement these entry-level standards into the country. We have had notable success, especially in the southern states. We are talking to IRDA. Now IRDA has got 33,000 hospitals under its wings for empanelment, and they have in principle agreed that any hospital which will be empaneled by them will have to have accreditation, the entry-level accreditation, and this is going to be create a huge impact in the country, because you are talking at quality at the grassroots. Also, the entry level, we are targeting the smaller nursing homes, which find it difficult to pay the fees of NABH to go in for the various consultants, etc. So we have bought out a book on entry-level accreditation, and this book will serve the purpose of those hospitals looking for entry-level. There is no need for consultants to be hired for this purpose. This is what was bought out, and this was bought out along NABH and the World Bank, and it is available on the NABH website. Now, the other area where CAHO has played a major role is in the role of healthcare communication. Also before that, we facilitated feedback for the 4th edition, which has recently been released. And speaker after speaker has been talking about communication. And we have been able to introduce the incorporation of healthcare standards in the 4th edition of the NABH standards. So in communication, as I said, CAHO, along with Bangalore Baptist Hospital, and with the publisher, we have actually started a dynamic movement on healthcare in the country. It's been on for about 2 to 3 years. We started with a textbook on Communicate, Care, Cure, which is now, the first edition did excellently well. The second edition is on now. Subsequent to that, we started nationwide communication workshops all over the country, training the trainer. And we have now finalized a program on e-learning, which would be available to all in the next couple of weeks. This is the book that we had written, which is the second edition is now being circulated. Now, other activities of CAHO in brief. As Dr. Gyani mentioned, CAHO is represented, and I must thank Dr. Kalra for this, is represented on the board of NABH, and this was a very positive step, and Dr. Gyani, I want to thank you once again for your efforts in this. So all the stakeholders are now represented on the board. We are also represented on the task force on public policy of health of Karnataka. Incidentally, Dr. Kasturirangan is the chairman of the Knowledge Commission in Karnataka, and he's looking at a lot of innovative ideas, and we hope that this task force will come out with some recommendations also in the area of health communication and other important areas. CAHO is also represented on the National Steering Committee. I made a brief mention. This is the committee which got together to tell ourselves that we need to self-regulate ourselves, and then this, the issues of compensation, etc., would come down. So as a result of that, as already mentioned, along with the IMA as our lead partners, there has been progress on the capping of compensation. Also, we are a very important part of the Association of Healthcare Providers, and work closely with the Health Sector Skill Council in Karnataka. This is a meeting of the task force of the health policy in Karnataka. What are the policy achievements? We have contributed to the various bills in the Union Ministry. We also consult with HCOs regularly with regard to quality. Another important one, CAHO is also, again, this was an AHPI-IMA partnership where we are looking at changing the law with regard to PCPNDT. And we are lobbying with the government. Hopefully we will succeed, basically to say that ultrasound should be made available to the public. It is now not available because of the very draconian provisions of the PCPNDT Act. And I think there is progress, and this will certainly improve the quality of care that is being given in our country. Devi spoke about quality of care dependent very, very highly on nurses. We are working very hard in that area. We've had some success, and I think very soon the Ministry of Health is going to start the nurse practitioner course. With regard to greening and energy initiatives, which are very, very important, we have taken a few steps. We have an MOU with EESL. They're also participating in the conference today. We also involved in the disaster management. We've organized a roundtable meeting on greening the healthcare, which is very crucial to our country for the health sector in New Delhi. And also with regard to the biomedical waste management rules, again, with the central government. CAHO has taken on a project in Karnataka where we are helping them accredit 4 government hospitals, and have good news is that one of the 4 government hospitals has been awarded the Kaya Kalp Award, and they're going to Delhi to receive it. There are 4 hospitals, and we have plans to expand this to other areas also. Yesterday, we had the privilege of being with at a government function where 2 hospitals, Jayanagar, those of you from Bangalore, Jayanagar and Malleshwaram hospitals were given progressive accreditation, and this again was facilitated by CAHO. We also got into training of entry-level assessors and handholding during the accreditation process in different states in the country. And we were a knowledge partner in the international conference held in Bangalore recently. Technology is a very important part of quality, and CAHO has recognized this, and our Secretary General Vijay Agrawal has taken the lead. We're looking at 2 areas of a mobile app and evaluating software which will help in the journey of quality. Other publications of CAHO, we were involved with the handbook of healthcare quality and patient safety, and also have done some work with the Planning Commission in with regard to elder care. Of course, we've got 2 very strong partners, NABL and NABH, and it's together with them that we will be able to make progress in the country. CAHOCON 2015 was held in Delhi. This is our 2nd conference, and the first one was a resounding success. We had 400 delegates from all over the country. I think this conference, we have about 500 registered. I think one of the important sessions there was the interaction with the CEOs of NABL and NABH, and that is also there in this conference. This is just a few snapshots of CAHOCON 2015. The way forward, I think CAHO is there to spread the message of quality throughout the nation, and I'll just end with another possible move which will bring quality to the grassroots, as was done with the entry-level accreditation. Now, in our board meeting at NABH, we discussed various options. Though NABH is not regulatory, how can we encourage the spread of quality in the country? And one of the things that we're actively looking at, we're discussing with the Ministry of Health, is all of us are aware of the Clinical Establishment Act in various states. which really focuses more on infrastructure, really doesn't focus on quality. So what we are proposing to the government is that all the hospitals, and here even clinics have to be registered under the Clinical Establishment Act. What we are proposing to the government, and Dr. Kalra will second me on this, is that let all the hospitals and clinics be registered under the Clinical Establishment Act, but those which have entry-level accreditation will not fall under the purview of the Act. So that means there will not be inspections, etc. I think this would be a huge change of introducing quality in the country, and my request to all of you here is from different states, is take this forward, talk to your state governments, and CAHO will support you in this, because this, I think, is going to be a big step forward in the spreading of the quality message in the country. Thank you once again.